Hello guys, my name is Mega Utami from 2B of the Health Polytechnic Palembang, majoring in the nursing.
Okay, in this video we are going to start off by talking about the nursing process. So there are 4 steps in the nursing process. The first is assessment and data collection. So this is include collecting data such as subjective information like the patient's pain level and what that pain feels like, and also objective information such as the patient's vital signs. So, what's really important for you to remember is as a nurse, you always want to assess before you take action. So, if you get an exam question saying a patient is short of breath, what is your priority nursing actions? Well, it's not gonna be to just call the provider or crank up the oxygen. Right? It's probably going to be something like listen the patients to see what you heard, check their SPO2, do your assessment first before you take action. So super important to know for exam. So the next step is implementation. So this is where you are going to perform your nursing care and you are going to document your patient's response to the interventions that you are doing. And then the fifth step is evaluation. So this is where you are going to compare the actual result with the planned outcomes and determine next steps. So if your interventions were successful and the patient has met those outcomes, then great. If not, then you go to work on plans B and next steps. Okay, so that is the nursing process. Let's talk about patient admission. There are several things you need to do. Admitting a patient is pretty time consuming, but there are a lot of important things you need to do, and we're gonna go over a view of those key items. So first of all, you want to document your patient advice directive status like right away because of something so go suits will they are there in the hospital like cannot feel a pulse. Do you call a code blue or they a DNR to not resuscitate patient? So you have to get real clear with that at the beginning. You want to document the patient vital signs, their height and weight, their allergies. You want to do a head-to-toe assessment, take a health history, and then figure out if they have any spiritual or cultural considerations that need to do. You need to accommodate while they are at the hospital. All of there are really important things you need to do when you are admitting a patient to assess them for their ability to swallow safely. So we at my hospital we give them just a little bit of water and checks for their swallowing. Are they like coaching immediately? Are they having difficulty swallowing? If you have any concerns that they are not able to swallow safely, then you need to keep them in PO until you get a swallow evaluation by and you can go who the resource based on our last video. It's the speech language pathologist. That's the person who's going to the swallow evaluation. Okay, you also want to do a safety assessment and implementations for precautions if appropriate. So if your patient is at risk for falls because they are either unsteady, they are on medications that can make them unsteady, you need to make sure you keep the bed and the lowest positions. You want a bed alarm, and then depending on your facility, we put like a little like failing star or something outside their room to let staff know that there is patient is on small precautions. And sometimes they also get a bracelet that indicates they are on fall precautions. And then you want to inventory the patient's belongings, valuables, and the facility safe. Ideally, we want to send home as many valuables and possible. with like a family member, but if there's any then remind we want to call security and get those put in the safe. And then we are going to want to do a medication reconciliation. So this is where we take in like with the patient intake, we figure out what all their home medication are, what they take at home, what does, what time, etc. And we try to reconcile this with whatever the provider is prescribing to the patient. And then lastly but probably most importantly, discharge planning actually start admission, and that's really important one to know for your test. So we are already think about how is patient is going to discharge as soon as they walk in the door at okay. Let's talk about patient transport now. So when they are going from one unit to another, you want to ask some kind of tools such as S-bar. So S-bar standard for situation background assessment and recommendation. So this is a great tool to ask. You are giving report to the receiving nurse at the other unit, so you are letting them know what the patient situation is, a little bit of the background and your current assessment, and what your recommendation are for the patient. And then in terms of discharge, let's talk about some key component of this discharge paperwork and just the teaching you need to do. So in the discharge paperwork, you definitely want to include the patient's diet and activity requisitions. You want detailed instruction provided to the patient for procedures that will need to be done at home, such as wound care. And then you want to provide a list of medication to the patients, when to take each medication and any kind of precautions regarding the medication. You want to provide the patient information about symptoms of complication and when to seek medical attention. And you want to provide follow-up appointment information. So 9 times out of 10 as a patient is leaving the hospital, they will need to follow up with their primary care provider within a couple days. And then you always want to provide names and number of providers and or community research that the patient may need when they discharge. So that is some information about admission, transfer, and discharge. We will pick up with my next video.